I hope I don't have cinnamon sugar all over. We're chowing down on those warm muffins. Nothing better. All right, we're going to take a break from cooking for a minute to talk about the basics when it comes to managing pain. I think a lot of people out there suffer from pain, all sorts of pain, back pain, neck pain, and they just don't know what to do with it, so they live with it. And that's not a good thing. So Dr. Doug Gateman is here from the Ascend Pain Institute in Appleton, and we're here to talk about finding a solution to that pain. Good to see you, Doctor.
Thanks for being here.
All right, let's first talk about, you're always giving us lessons on how, you don't have to live with the pain. There are a lot of things out there to help.
Correct. Well, what we're talking about today is the epidural. Everyone's heard of epidurals.
Yes.
Labor and delivery epidurals,
right,
as you mentioned earlier.
Right.
That's to get rid of the pain of having a child. Mm-hmm. So it's just the cocktail, easy way to put it, you put in there, makes things numb. Now, for the pain world, same thing. If you have a pinched nerve in your neck, pinched nerve in your lower back, or the spine's getting a little tight, you get these weird sensations in your arms or your legs. So the first thing you want to do is, first physical therapy and normal conservative measures. If that doesn't work, then the next thing depends on what the symptoms show. We do what's called an epidural.
Okay.
So everyone's heard of that.
Yes.
It depends on what we're putting in it. It depends on what we do. I throw a lot of local anesthetic in just to make it numb, so we make sure we're in the right spot. So it's sort of diagnostic as well as therapeutic. So the steroid you put in a little for a second part of the medication is what makes the inflammation go down and calms the pain.
Okay.
So it depends on how tight it is, depends on how long it works. So I tell my patients all the time, this is more of a temporizing, calming it down. It's not fixing the problem, but it's making it so that it's not an issue. So in that sense, what we're doing, we're pushing off the ultimate cure surgery for a lot of this stuff.
Oh, okay.
So we're pushing surgery way off. It could be weeks, could be a couple years. So it depends on how tight it is and what the problem is.
It's kind of the stopgap type thing. It's a shot, correct?
Correct.
Right. And what's the longest you've seen it last? And what's like give me an example of a case where it really has helped.
Well, one of my gentlemen who we have on our advertisement, he's a salesman. He runs around the state all the time. We give him an epidural. He has a pretty good disc sitting right on a nerve, and it shoots down his leg. Mm-hmm. So what we do is we calm the irritation of the nerve, and between that and his physical therapy and stretching he does, that lasts 6 months, 8 months.
Wow.
So, and he does racquetball. He does, which I cringe when he tells me he plays racquetball.
Right, that's an intense sport.
So, but he's so active, he goes from there. He knows the ultimate fix is going to get surgery to release the pressure off that nerve, but in his schedule, he can't do it.
Right, right.
So a lot of times people come in with a tingling arm, and, we'll do an MRI to see what's pushing, and then we'll put the medicine in to calm it down. And I tell the patients, this is a Band-Aid. It's not a permanent fix. Mm-hmm. But it does calm it down, and hopefully we can keep it calmed down so you don't need surgery this year or next year. We can just sort of push it off a little bit.
Sure, and some people need that extra time to get off work, or maybe they're nervous. They want to look at all the alternatives and things like that. But bottom line is if you have any kind of pain like that, there is help out there. You don't have to necessarily live with it.
Correct. If you're not sure what it is, there's always something going on. So pain means there's something wrong. So we have to find out what it is. It's not just, I have a pinched nerve. Well, why do you have a pinched nerve? What's going on? So, it's always fun to figure out what's causing the pain, and then you treat it and have a little plan, and I tell the patients down the road, there's always something else we can do.
Right, exactly. All right, and one thing could be the epidural, though. Appreciate it.
Thank you.
All right, good to see you, Doctor.
Good to see you. Thank
Appreciate
you.
it. We've got muffins, lots and lots of muffins.
Sticking around.
All right, good deal.